Community and home-based care service is one of the critical care and support services provided to people living with HIV in Nepal. CHBC teams provide basic health services, social, emotional, and spiritual support, reinforcing the concept of positive living and reducing stigma and discrimination in the community. Khatay Nepali is one of the CHBC team members in Doti, Far West Nepal. Khatay was born to a poor Dalit family in Far West Nepal. Needing employment like many in his village, Khatay left for India. While there, he contracted HIV and after returning to Nepal infected his wife. The consequences were extreme. He sadly lost his 2-year-old son and 2.5-year-old daughter. He endured social discrimination and every day was a struggle to make ends meet. After my son died in Sethi Zonal Hospital, I went to bury him on the banks of the Mona River. No one would even lend me a spade to dig the earth. Back then, everybody thought even sharing a spade transmitted HIV. After receiving counseling and learning about how to prevent mother-to-child transmission, Khatay and his wife now have a beautiful 11-year-old daughter, Bhagirathi Nepali. She is HIV negative. My work as a CHBC team member in taking care of my daughter has given me a new lease on life. Once on his deathbed, Khatay is now a CHBC team member. He travels to his district crisis centers and villages on foot, with a declared mission to help people lead healthy lives. Khatay reminds people living with HIV to take their medicines regularly. He shares his own experiences, hoping to reduce the fears of stigma and discrimination. He helps people to lead normal lives. Khatay Nepali and the CHBC team leader, Tara Mahara, are greeted by villagers before departing to the field. Tara's house often serves as a makeshift shelter for people living with HIV. Tara says, "Even though I am far from family and home, I'm always happy to serve HIV-positive people." For the past 3 years, Tara Mahara has dedicated her energy and expertise to provide services to 8 villages in Doti, some very, very remote. Her work begins at dawn, checking and refilling her CHBC kit. When asked, "What is the most difficult part of your work?" the team replies, "Crossing over the rugged landscape and reaching all of our patients." Taranath Saud, who receives regular visits from the CHBC team, is thankful for the services provided by Khatay and Tara. Taranath says, "They gave me strength, support, and saved my life. When in Mumbai, I was young and used to frequently visit beer bars, and in return, I got HIV. With a family of 3 sons and a wife, I cannot afford to be sick. I am now committed to leading a healthy lifestyle." Taranath's wife, Jankri Devi, said her husband left for India in search of work. He fell ill while working in Mumbai. When he returned to our village, his health continued to weaken. It was after we got help from the CHBC team that his health improved. Like Khatay Nepali and Tara Mahara, CHBC teams are providing much needed services to people living with HIV in rural communities of Nepal.